On this episode, we'll talk about having surgery with previous stents placed in your heart. We'll also talk about having a bigger stomach at the time of surgery and your outcome, and we'll talk about pain management after surgery. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to the AskDrA Show, episode 137. Thanks so much for being here. Thank you so much for sharing the show, sharing it on Facebook or with a friend. As you know, and if you're new to the show, absolutely only thing I ask for is for you to share it. Share it with someone and only if you get some good content and some value out of these shows, all right? So let's jump into the questions.
Is surgery safe with stents?
Yes. Can you have surgery? Can you get surgery if you had previous stents in your heart? The answer is yes. Can you get surgery if you had previous open heart surgery or a heart condition? The answer is yes, but there's a big but. But it has to be evaluated by your bariatric surgeon, number one, and in conjunction with your cardiologist. So what we do personally in our practice is we get clearance by the cardiologist just to make sure you as a patient are A-okay, because believe me, nobody knows your heart, not even me, nobody knows your heart better than your cardiologist. So he has to give you the clearance, the good to go, to be able to jump aboard and having weight loss surgery. He knows then that you losing weight will be the best thing that you can do for that heart of yours.
My stomach was larger than normal. Will this affect my success in weight loss?
Okay, so yeah, it's a really good question because sometimes we go into surgery and you see a short lady and has a very big stomach, even larger than a regular man's stomach. Normally men have bigger stomachs. Or a big guy and has a big stomach, and will it affect the outcome down the road? The answer is no, because it's always a fraction of that person's stomach. So it's more a personalized procedure, and that is why I came up with the slogan, our slogan, changing lives one sleeve at a time, because every single surgery is very individualized. It's very personal. Your stomach size and shape will be different than mine, so every surgery is completely personalized. So it's very important for the person to know, the patient to know, that the surgery is personalized, and the percentage of stomach removed, well, it's a percentage of that person's stomach. So the outcome is expected and well studied. So it won't change your results, or if you had a bigger stomach, will you do better or worse? No, it doesn't relate directly.
Do you give any medicine for pain management after surgery?
Good question. Yes, it's something that we get a lot, and a common question in our consultation or evening appointments. So the answer is yes, of course. We manage pain right away from the get-go. Patients in recovery get pain medication right away. Patients are comfortable. Our patients are getting up to the restroom right after surgery, 2-3 hours after surgery, average. Of course, this pain management is managed. We've got many years. We've got over 12 years of doing this procedure, so we know the precise timing of scheduling medications for pain, for nausea, anti-inflammatory, so on and so forth, for the patients to be very, very comfortable. We call it the perfect recipe. It's something we haven't modified in quite a few years already, because we have it down to the T. Patients recover really nicely, and also it's very important for the patient to be comfortable to get up and walk, but not too comfortable to make them sleepy. So we have to manage that balance, and we have it down to the T. Once the patient goes home, we also send them home with pain medication. We send them home with a prescription, and it's already filled out for you, well, the patient, not to be worrying or stressed out about the pain medication. We give out the medication, we give out the prescription, and everything's laid out nice and good. All right, so that is it for episode 137 of the Ask Dr. A show. I got a question for you, and I need some feedback, all right? Let me know where you had your surgery down in the comments below, and how is your pain level. Pain level, maybe just, let's use a scale 1 to 10, all right? 10 being super extreme, and 1 being a piece of cake. How about that, all right? I'm Dr. Alvarez with Endobariatric.com, where we are changing lives. There you go again, one sleeve at a time. Take care and God bless.